Hi everyone, thank you for joining us for On Call for All Kids. Today we're going to be talking about food allergies in kids. We're going to be telling you the most common food allergies in children, how to know if your child has allergies, and the latest treatments to help kids. I am joined by Dr. Panita Sriarun. She's the medical director of the Food Allergy Clinic here at JohnsHopkinsAllChildren'sHospital. And Dr. Sriarun, great to have you here. And really, food allergy is something you're seeing is more common in kids.
Oh, it's very, very common. This is what we see every single day, of course, because we are food allergy clinic. But definitely prevalence is on the rise. Now we see around 2 kids in every classroom with food allergies, either mild, moderate, or severe, but it's real.
And do we know what's causing this uptick, or what causes food allergies?
Well, one factor for sure is genetics. You know, if you have one parent with any kind of allergies, any asthma, eczema, food allergies, then your kid has around 40 to 60% chance of having any kind of allergies. And if both parents have allergies, you could have probably around 80% chance of having allergies. Another part would be environmental factor. You know, it could be, how we process the food, how we live, how we're exposed to germs. You know, we have a new term, microbiome right now. It could be that, but we don't really know for sure.
Well, I hope there's more research being done. We can kind of get to the bottom
a lot more
of
research.
What's going on. Absolutely. What are some of those top allergies that you see that are foods that are causing these allergies in kids?
Yes, for the common ones, we call them top 8. Although we know now that there's number 9 coming along. So the common foods, that the kids are allergic to are milk, egg. These are the kind of the first 2, foods that they're eating, right, when they're babies. And the next one are wheat, soy, peanut, tree nuts, and then fish and shellfish. And the 9th one that I was talking about is sesame seed. That's new kid on the block.
Wow, that is really interesting. How do we know these? I mean, obviously these are common foods. They're almost in everything that we're eating. So how do we know if our child is maybe allergic to one of these foods?
Well, first of all, it has to be kind of very obvious, which means the timing usually is minutes to a few hours. If the child eats something and then 2 days later having a reaction, is probably not a true food allergy reaction. Second of all, has to be reproducible in many shapes or forms. Milk is a perfect example. So if your child is suspected to be allergic to milk, but he can eat yogurt every single day, or he can eat like 2 slices of pizza every single day, then he is not allergic to milk. He might have milk protein intolerance or some other, conditions that related to that, but probably not true milk protein allergy.
What do we need to do from that point? If we see they maybe develop a rash, we see that consistency, do they need to come, see a specialist?
Right, so first of all, we have to take a very detailed history. If the history is clear, the kid had peanut butter for the first time, or scrambled egg for the first time and started having rash all over, or it could be any symptoms such as GI symptoms, vomiting, diarrhea, cramps. It could be the throat closing. If that's the case, it's likely that that's food that's caused reaction.
Okay. Now I know they can do skin testing if they come in here.
Of course.
Yeah. What does that look like? You actually brought that with you today.
So for the skin testing, we do it usually on the back, the plastic tips sitting in the well, and you can see this tiny drop of allergens. Yeah. These are known allergens that would produce local reaction, almost like hives on the back if the patient's allergic to the food. And we can see the reactions on the back as soon as 15 minutes.
Wow, good stuff. You can also do, you said this is called the oral allergy challenge, where they're brought in, they take a little bit at a time.
Yeah, so once we do the skin test, usually we top up with the blood test. Both of them are really good, but they're not perfect. And they tend to cause false positive results, which means we can eat the food, but the test shows possible positive or positive results to that food. What does it mean? So those tests can be very confusing. So we do the history, we do skin tests. Most of the time, we do the blood test as well, and we follow by oral food challenge, which means it's supervised feeding, but we do it in a gradual fashion. We start from a very small amount, do the lip touching. Within like 15-20 minutes, if there's no reaction, we give this next dose, and the next dose in the incremental fashion every 15 to 20 minutes. And usually we observe the kid for up to 3 to 4 hours, and 1 hour after the last dose to make sure there's no reaction. Usually, if the patient is allergic to the food, we will see that within that time period, 4 hours. So it can be very anxiety-provoking, but it can be, a very cheering moment, like, yes, we can eat this right now.
I'm not allergic to it.
Exactly.
Good.
Yeah.
And coming up next year, you have another therapy that you're going to be offering. Tell us a little bit about that.
Right. So next year, we're going to start offering oral immunotherapy, or OIT. Currently, treatment is not approved by FDA yet, but we know from literature, there are several publications from the United States and other countries as well that the treatment works. And the prototype is peanut, although we know that the concept works for other food allergens too. So food OIT, the concept is to give small amount of the food that the patient is allergic to produce tolerance. It's not a cure. So the goal is not to have the patient go and eat that food in large amount, but instead of having severe reactions, when the kid accidentally eats that food, then they would just, oh, fine, and we just observe the symptoms, and usually it's not progressing into anything more severe. So this is more like a peace of mind.
Like a life-saving technique almost, that
Correct.
You're always going to want to have that EpiPen with you, but in that situation, if you did ingest it, you wouldn't want anything bad to happen, so it would prevent that. Wow, that's wonderful. Thank you for all of this information and teaching us more about food allergies in kids. And if you have a topic idea you would like us to cover, you can just comment below right here on this video. And we also have a great amount of information on our website. That's HopkinsAllChildren's.org/newsroom, and you'll find a lot of patient stories and pediatric healthcare information there as well. We'll see you next week. Thanks for watching.